This is the Nurse 406 final. My name is Luke Bowler, University of Arizona Global Campus. Dr. Debbie Beck is the instructor. Today is the 18th, November 18th, 2024. All right. So the issue that I have chosen here is nursing shortage. Nursing profession continues to face issues with a shortage of educators, high turnover, and uneven workforce distribution. An increased number of nurses departing in respected hospitals has continued to cause issues of understaffing in the healthcare setting. Nurses are leaving due to better pay, retirement, unfair working conditions, and a host of other issues. The 2020 HRSA nurse workforce projections report that there will be a projected shortage of nearly 78,610 full-time equivalent RNs in 2025 and nearly 63,720 in 2030. So kind of an analysis here, the problems that and risk areas that we're facing is essentially just loss of staff. Multiple units throughout hospitals are understaffed. This causes other units to float their core staff in order to help. This issue creates kind of a bigger issue of having nurses who are really uncomfortable in roles that they're not trained for. Lack of staff can also increase traveling nurses who are also more unfamiliar with the hospital setting as well as their floors, which can become unsafe for the patient, which is ultimately the main purpose for why we're here. So again, who is at risk? Well, the nurses and patients are both at risk. Understaffed hospitals become a risk for nurses because they are expected or required to do more for their units. If the nurse is not trained properly, this can become an issue. This also becomes a problem for the patient as they may not receive the proper amount of care that they do need. Ways to mitigate this risk. A couple of big mitigation. Increasing pay. It's not the reason why we work, but it does help keep the staff where they are. This increasing pay can help meet the standard market price for nurses. Also monetary retention bonuses. If nurses are there for a certain amount of time, they can get paid extra for maintaining their employment with the same hospital. Also, cross-training nurses in different fields can help better those who regularly float, and this can help reduce the risk that may be present for patients. Further actions that can be taken. I've already stated, a big reason nurses transition into a traveling position is because of the pay increase. If hospitals want to keep their staff, it makes more sense for them to offer incentives for staying with the company. As the years progress, these incentives increase, enticing staff to remain put. This can also be considered for new hires as well, bonuses, with contractual obligations to stay longer for these new nurses. Who's responsible for this? Well, hospitals overall, and then the help with government grants. An action that could be taken to help with the issue in retention is retention bonuses for staff, as we kind of stated. One of the biggest reasons nurses transition is because of pay. If hospitals want to keep their staff, it makes more sense for them to offer incentives. And that really comes from within the hospital. Definitely like the board would have to decide, maybe move some money around in order to help pay these bonuses to better equip the staff. So a couple evidence-based articles that I chose here. This first one, Distressed but Not Deterred. Nurses reveal solutions to the nursing shortage in the aftermath of the pandemic. This article explains the aftermath of nursing shortages, particularly after the COVID-19 pandemic. The authors here explain the main reason as to why nurses are leaving healthcare, as well as to top reasons why they are considering leaving. Although the outlook looks bleak, current nurses are surveyed on certain factors that need to be addressed in order to help alleviate the alarming number of nurses that are leaving. Nurses within the testing claim that better pay and more substantial working conditions can help the nursing shortage. The second evidence-based article is just titled Nursing Shortage. And this one kind of summarizes the effects on both staff and patient care, as well as some possible solutions. Clearly defines what the nursing shortage is and how it affects both the staff and patient care. The authors continue to discuss contributing factors as to why staffing has begun to decline and why it will continue this trend into the next decade. The article does offer some short and subtle solutions on how to fix some of these issues that the nursing shortage has created, which include better staffing ratios, technology, and nursing empowerment. The third article here, Team Nursing, an innovative approach to address the nursing shortage. This article explores the critical issue in healthcare that is the nursing shortage. It addresses patient, nursing, and organizational outcomes associated with this shortage, as well as nursing satisfaction within the workplace. The authors here explore alternatives and solutions to help with the shortages and how they can have a long-term effect on the healthcare system. Just some of the solutions that they offered primarily were team nursing, so where essentially the floor bedside nursing becomes more of a team effort as opposed to one nurse taking one patient. And then just further education for nurses can help create just a better overall work environment. Okay, so theoretical framework for change, again, solution that could help retain staffing is by offering retention incentives. There's an example of the Palomar Health, which is based in Escondido, California. They decided to try this method of retainment by offering a $100,000 retention bonus for staff that were willing to stay for 3 years. The results were very positive for the organization, while the hospital was able to rely less on travelers and agency staffing and more on core staff. What made this decision even more impactful is that the incentive was not only targeted towards new hires, but also current staff, which saw an increase in morale and overall production. The hospital had already established a strong culture by investing in leadership and team-wide wellness that included one-to-one program wellness coaching for staffing. The Bureau of Labor and Statistics reported that the average salary for nurses in 2022 was $77,600. While this is a modest income, it pales in comparison with other wages within the hospital, especially when travelers are making 2 to 3 times as much as the core staff. To further expand on this framework for change, here we talk about Cotter's change model, which is an H-step model. Here we have creating a sense of urgency, which is inspiring people to take action with passion and purpose. Forming a guided coalition, so putting together a team to lead change. Developing a vision and strategy, which would create a clear vision of the future. Communicate that specific vision, ensure that everyone understands the change and why it's important. Remove obstacles, which is just removing the barriers to change adoption. Create short-term wins, celebrating small victories that motivate people and build momentum. Consolidate gains, sustaining the changes continuous process, and then anchoring those changes, so making it part of the culture. As seen in the previous slide with that example, definitely had implemented this model to help So for budget purposes, obviously we need money needed to train the staff, and then additional funds for incentives and bonuses. The 2019 National Healthcare Retention and RN Staffing Report would suggest that every % change in nurse turnover can cost a hospital nearly $328,400. This could be the difference of millions of dollars being lost annually by hospitals that are consistently losing staff. Furthermore, in 2016, Streamline Verify found that 43% of newly licensed nurses leave their job sites within 3 years. 33.5% resign after 2 years, and 17.5% work only for a year. So this loss of staff can cost the hospital a lot of money. A sample budget that needs to be considered is how much money the hospital is saving in the long run by offering incentives and bonuses for staff retention. Ideally, each department would need to look at how much they have saved or lost in the last few years to determine whether these bonuses are necessary. If a hospital has been having issues with nursing shortages, undoubtedly they have been spending a greater amount in travelers, new hires, educators and preceptors, and other resources. For this purpose, annually, a hospital has spent $1 million on providing additional resources due to loss in staff. This is an operating budget and shows the different trends that have been utilized by the hospital in the past. In contrast, budgeting additional funds for bonuses and incentives in order to retain staff can increase revenue in the future. So putting $750,000 towards incentives will add to the capital budget for a hospital, but will increase revenue for the years to come. By spending more money in the current or in the present, less of the budget will be used for turnover rates in the future. So some stakeholders that are involved with this process. One would be the employees, of course. This is the nurses and kind of like their statuses. It also includes other areas of healthcare, physicians, different kinds of therapies, etc. The employees are probably the key stakeholders in this process, and really, in order to decide like the effectiveness of it would be kind of their status and their retention rate. The patients, it's kind of what makes the hospital tick. Without them, there's no purpose for the organization that exists. The patient and the nurse will need to be looked at over a period of time in order to determine how well the change is working. However, greater patient satisfaction would indicate that these incentives are in fact effective. Government, another stakeholder here, they are more than likely providing the assistance for these higher wages and bonuses being given for the hospitals. Implementation. As far as changes within the hospital settings are concerned, new policies would be implemented to ensure that nurses are maintaining their requirements in order to be eligible for their bonuses or incentive. Oftentimes, hiring bonuses are distributed amongst new hires based off of their willingness to stay within the hospital for a set amount of time. If they are unable to follow through with this, then the portion of their bonus is retracted, generally prorated with how much time they have left on their contract, or how much time they did not fulfill. Similar circumstances would need to happen for an incentive based on retention. For instance, if nurses are willing to stay for 3 years, they will receive X amount of dollars. The longer they stay, the more they might be able to receive. So timelines for this could include just a year, and then annually you could receive extra funds, or you could do 1 year, 3 year, 5 years, etc. It really just depends on the hospital and kind of what the preference is. Higher wages can be found or would be handled by the board, who would probably need grants from the government, going back to the stakeholders. Market raises can be assessed annually so that nurses are being paid fairly based on their region and area of expertise. Essentially, this would be compared to other areas in the country and how much they are paying their nurses. This may change the status quo of how hospitals assess their nurses. For instance, assessing performance, reviews, job responsibilities, and skills annually can greatly increase the need for specific nurses. Methods. Annual surveys, just to see how nurses are responding. Are they satisfied with their jobs? Is this incentive-based program working? It might take some time to kind of get a gauge on it, but just to kind of see where the satisfaction is amongst the staff. And then obviously just statistics. Are nurses staying longer than they had previously been? Are hospitals retaining? Are these bonuses helping? Are these wages, increase in wages helping? And then if there are less travelers, they're more than likely more for staff, which would mean that staff or nurses are deciding to stay with their hospitals. Some barriers with this monetary incentive-based retention plans is the funding. Money has to come from somewhere. Also, possible ineffectiveness just overall can be an issue as well. If hospitals are unable to gain access to funds, it becomes more difficult to pay their employees. There is the issue that this may not fix the problem with nurses wanting to leave. Some may just want to leave regardless of the pay. Sometimes it's not all about the money. Implementation. Hospitals must be willing to compete. Market wages is huge here because just comparing with the rest of the country would keep nurses in place based off of getting that additional money. Sign-on bonuses help to just retention sign-on bonuses, annual bonuses, and then getting that additional bonus for new hires could help too. So in conclusion, unfortunately, employee turnover is a part of any organizational structure. However, hospitals have been experiencing a heavy decline and greater losses, mainly due to nurses being unhappy with their current status. This can include unsafe working conditions, lack of pay, and other problems that arise in daily activities. To combat these excessive turnover rates and nursing shortages, hospitals can plan to pay their employees more by comparing them to market wages nationally and setting aside additional funds in their budget for sign-on bonuses and retention incentives. References here.